Hello, my name is Gail Moxley. I am a student at Grand Canyon University in the Operations Management course. Today we're going to be talking about process improvement for ambulance services for healthcare services. And the purpose of this project is to increase ambulance services by reducing, as well as reducing overall costs. And there is a low prevalence of ambulatory services in the region, as well as high death rates because the ambulance services do not have the right disciplines operating within the ambulance services. And there's high cost to ambulance services, largely attributed to the high cost of acquiring top quality paramedics within the ambulances. So a lot of the ambulance services are using non-clinical personnel to operate their ambulances, and that is again making for high risk transfers within the ambulances. So I performed a stakeholder analysis on this project, and it involves 4 primary key stakeholders, and they are the patients, the healthcare providers, the employees, and the financial department. And on the patients, those are those who need ambulance services. The healthcare providers are those in the hospital, mainly in the emergency room, as well as in administration, who deal with the contracts with the ambulances. And then the employees who are in the ambulances, those who work for the ambulance service. And then the financial department, who looks at the cost, and those are the ones that fund the ambulance services, and that can include government, self-insurers, donors, as well as patients. The strategic approach I took to managing the stakeholders was, there's 3 strategies, and they fall into 4 quadrants. There's a low power, low interest, and strategy 2 is low power, high interest. And then strategy 3 is high power, low interest, and strategy 4 is high power, high interest. And as I go to the next slide, you will see them in the 4 quadrants. So the employees are in the high power, low interest, and we want to keep the employees satisfied. So that helps retaining the employees. And then the patients, they're in the high power and high interest, because we want to keep the patients healthy. We want to give them the high quality of care, and it should not matter the cost or anything for the patients. They need the high quality care. For the financiers, they fall into low power and low interest, because ultimately the financiers are the ones that ultimately pay, but that should be last for the quality of care that's provided. And so the financiers monitor the care, but they just look at the overall cost. The healthcare providers fall into high interest and low power, and we need to keep the healthcare providers informed throughout the process. And so they're a key stakeholder, and they need to be involved in this as well. The proposed solution to increase ambulance services to healthcare providers, but to lower the cost, is the best solution is to increase funding to the ambulance service departments in the healthcare sector. The government should be involved. We should be including the government in this, as a lot of payers are government source payers, meaning Medicare, for instance. And they should allocate more for the Medicare patients. The donors and well-wishers should continue their support through grants and donations. We see a lot of that in the high areas, well-off areas. So it would be nice to see to increase those in the lower population needed areas. The patients should support through contributions under the ambulatory services program by providing payment as well. The project timeline would be at the very most 12 months. We want to try to get this project going as soon as possible and ultimately completed within 12 months. We should be lobbying the financiers for more funding, so we should be looking at government resources as well as the hospitals and any other resources, donors that we could possibly tap into. We should be acquire new top quality paramedic ambulances, and what would help with that is securing contracts with key ambulance services to see if we can contain better contracted rates in certain regions, and to where we are only calling for certain ambulances within those regions. The ambulances need to hire and train qualified paramedics that will manage and operate the ambulances. They need to steer away from the non-clinical disciplines. They can be secondary within the ambulance, but they really need to be housed with paramedics within the ambulances. They need to create and promote ambulance services program among potential clients. So as we work with the fire departments and the government and external agencies, for example, skilled nursing facilities and other areas, we need to promote the ambulance services that we have contracted with. The communication plan that I developed is very important for this to succeed. So in this case, the different stakeholders will have different communication plans. So for employees, financiers, and healthcare providers, that should all be face-to-face communication. Face-to-face should always happen as much as possible, and we should set meetings up, education, to set this project timeline, continue to talk with them and set the contracts to increase the ambulance services, and then to decrease cost as well. We need to, for the patients, we need to send out mass media platforms, including print and broadcast media, and then also possibly TV and internet and any social media around the ambulance services that we provide. The project evaluation metrics that have been developed is the fleet size of the ambulance service providers. So what is the size of the ambulances? How many do they have? How many are called? How many can they produce? What's the volume that each ambulance service can provide? The prevalence of ambulance services within the community or region. The final cost of ambulance services. So we should be monitoring that cost, the overall cost of the ambulance services passed on to the patients, and then also as well as the government and the hospitals. So how much do the hospitals have to pay or write off versus what does the government pay, what do the payers pay, and then what do the patients have to pay. And then the amount of revolving fund for the ambulance service providers, and the seamless collaboration of the four primary stakeholders. What was their involvement? How is that going? We need to monitor that overall. So for my project, I used 3 references. One was substantial progress yet significant opportunity for improvement in stroke care in China. One was an action brief, patient engagement and activation, a health reform imperative and improvement opportunity for nursing. And then lastly, an emergency department overcrowding and ambulance transport delays for patients with chest pain. These overall talked about increasing ambulance services, providing higher, better care for the patients, as well as decreasing overall costs to the hospitals and healthcare at large. I thank you for listening to my process improvement project. Thank you.